have seen in the video, she did very well with the use of the ATM2, going from a 6 on the 0 to 10 scale to low back to 0 on the 0 to 10 scale. She also has neck pain. There are ways to use the ATM2 for neck pain, but I'm going to turn, sit up tall, turn your, relax, relax over you. I want you to turn your head to the right and tell me if you have pain with it.
Yes.
You do have pain and you stop right there, right?
Yes.
All right, go to the left. You have pain with that.
Yes.
Now, which way is more painful for you?
To the right.
To the right, okay. Is there one motion that you find more painful than any other motion that you can think of in your neck?
No.
Right.
Just in general, it hurts.
Okay. So I want to find what will allow her to move with less pain or no pain, improve pain-free range of motion, and the joint's normal physiologic state. Can you point to the area in your neck which is most painful? Okay, so let's look at that. I just want you to tuck your chin in slightly. Don't brace, don't guard. Try to relax. Just a slight chin. All right? I'm going to come up in here. And when you go to the right, I'm going to have you turn your head to the right. When you get to the end of the motion, you're going to put the left palm of your hand on the left side of your face, of your cheek, and apply overpressure at the end of the movement. There should be no pain. No pain increase, okay? So I'm going to lift up here. Let's go to the right. Okay? All right. Already we're further. Add a little overpressure. Pressure on, pressure off. Are you okay? Pressure on, pressure off. Pressure on, pressure off, pressure on, pressure off, pressure on, pressure off. Come back to the middle. You all right? Further now, right? Okay, let's try again. Is this a good location for you?
Yes.
Let's go again. To the right, all the way. Yeah, look at you all the way to the end.
All the way, yes.
Okay? Now put your hand on again. Pressure on. That's good. Pressure off. See how much range you're getting there. Right?
Good.
Pressure on. Pressure off. And let's come on back. Okay. Turn to the right again. How's that? Okay? Okay. Go to the left. Let's see that now. Any problem with that?
Right there.
Right there? Okay, hold your head straight.
Right there.
Let's try again. We're going to go toward the left. All the way to the left. Okay. Add overpressure. Pressure on. Pressure off. Pressure on. Pressure off. Pressure on. Pressure off. And again. Let's see how that goes. All right, turn your head to the left.
Much better.
Short. Okay. Go to the right. How's that? Now let's just check going backward now. How's that?
Fine.
You okay?
Yes.
Do you have any pain right now?
No.
Okay, now, now she can turn her head to the right and the left, and even backward, without producing any pain, where she had pain before, and I didn't have to manipulate the joint to take it out of its normal physiologic state. If I need to add more overpressure, I'm not quite doing it this way. There are many techniques I can use. Stabilizing the spine with this thumb, applying some traction, and using my hand around the base of her, underneath her skull. Come to the right, come to the right. I can traction lifting up, over to the right. And I can give overpressure this way. However, I don't need to do that, so why do it? Okay? One step at a time. Sometimes a patient can just do a chin tuck into the right and they're fine, if that doesn't. If that's not enough to do it, then I can add hands-on stuff. If the hands-on stuff doesn't do it and I need more pressure, I add overpressure. If adding overpressure doesn't do it, then I may add an end-range thrust as a last resort. Most of the time, an end-range thrust is not required. Okay? Also, when I did the initial mobilizations, what worked with this young lady was working right off the spinous process. I could have chosen the right facet joint or the left facet joint. However, this was sufficient for her purposes. Okay?